our joint effort. If you're having a challenge, you have knee pain, elbow pain, shoulder pain, there will be an educational video to educate you about what that probably is and what the best treatment is for it and what are all of your options. So for example, if you hurt yourself and you live in an area where you don't have a lot of access to great medical care and you go somewhere, and I love this one, and they say, well, you just rest it and it'll go away. Well, no. It doesn't. Your body doesn't normally go back to its normal musculoskeletal position just because you rest it. And then you go back out and do that activity like running, and it's going to come right back. So no, you have to get whatever the pathology is treated to get you back to normal, and then you can go on and do the things you want to do. So there'll be little videos about every body part, about what the best treatment is, and then there'll be longer videos to really educate you about, for example, a total knee replacement. That's a big operation and a big decision, and there's a lot of things you need to consider before you do it. So what I've done is created a bunch of educational videos, starting with the very first one, which is, how do you know you're ready for one? How do you know you need one? Maybe you don't, maybe you do, but let's make sure before you undergo that big operation with a long rehab after. Then next is, how do you pick your surgeon? What are the great questions to ask? What do you do 3 months in the beginning? What do you do? What does surgery look like? When should you start rehab? What does rehab look like? Very important, because that's about 80% of the fix of your knee problem or hip problem or wherever you're having your total joint. Then all the way through training to get you back to the activity that you want. So that'll be a long series of many videos, but it will take you from the beginning all the way through the end. And then you'll have an opportunity to do a one-on-one with me as well. So you get to the beginning and you say, well, I've got a bunch of questions and I just don't know if they were answered here. Let me talk to Kate for an hour and see what she says. Or you get to the point where you're 2 months out, and I'm saying at 2 months, you should have all your knee flexion, all your knee extension. You should be doing this and this and this, and you're not anywhere near that. So you say, I better have a chat with her again and see. And I would be happy to talk to your medical professionals for you, your physical therapists, whoever it is you're working with, discuss and recommend a treatment plan to make sure that you get the best possible outcome. So you will be able to educate yourself, learn a lot, and make sure that you know maybe some options that weren't told to you. You have all the information to make the best decision for yourself.